Good morning and welcome back. It's 8:42. February is American Heart Month. It's an important time to raise awareness about heart disease and a connection that a lot of people don't know about. We're going to talk about it today with Dr. Eric Lieberman, who's the Medical Director of Cardiology at Delray Medical Center, joining us now to explain how heart disease can also be linked to erectile dysfunction. Good morning, Doctor, and thank you so much for joining us today. All right, so, I mean, it's interesting the connection that the two may have. So can having erectile dysfunction be a direct result of heart disease?
It can be, and also the same risk factors that lead to heart disease can lead to erectile dysfunction.
Wow.
Issues with blood pressure, issues with diabetes. Fundamentally, they're vascular problems, so they are related.
They are related. I mean, I was going to say, what does your heart have to do with that? But I guess they're cousins.
Yeah, they're cousins, and the same disease process that can cause heart attacks, that can cause problems with blood supply to the heart, can affect erectile function.
All right. So when should people seek out a cardiologist potentially if they think that they might have, some problem with a heart disease that leads to erectile dysfunction?
I think when they realize they have an issue with erectile function, when they realize they have any other vascular problems, they ought to be evaluated by a cardiologist to see if the vascular issues are more widespread and if they need additional attention. And we should address those risk factors, treat cholesterol, treat diabetes, treat blood pressure, and understand that we can not only improve erectile function, but improve heart health in general.
Who might be most at risk of this, if that is the correct way to put it, at risk?
Yeah, most at risk are going to be patients with diabetes, followed by patients with high blood pressure and cholesterol. Furthermore, any patients getting treatment for heart disease, one of the side effects of the medication can also be erectile dysfunction. So while we're treating the disease, sometimes our treatment causes other issues that we need to address.
Are there a lot of people running around out there who have high blood pressure that are not taking some medicine for it?
Absolutely. They're not taking appropriate medication. They're not adequately treated. We're not getting to the goals that are recommended by the American Heart Association in terms of lowering blood pressure and lowering cardiovascular risk.
All right. So what can people do specifically to take care of this issue?
I think the first thing to do is get a blood pressure check, whether that's with your primary care physician, a cardiologist. Even go to the paramedics and get a blood pressure check at a fire station. Walk into a local grocery store or pharmacy. Get your blood pressure checked. Identify what's going on and then seek treatment appropriately.
All right. So in terms of treatment, is there something people can do so they don't have to go on medication?
Yeah. The first thing we want to do is lifestyle modification. Cut down on salt in the diet. Lose weight. Exercise on a regular basis. There are a number of non-pharmacologic interventions that we can offer patients that can reduce blood pressure and minimize or eliminate the need for medications.
It's a lot of the same things for a lot of different diseases that we hear all the time. It's just a matter of taking that next step.
Taking the next step, and it's not easy.
Right, exactly. Thank you so much for joining us. Very interesting.